We're live on The Alex Jones Show this Wednesday, October the 1st, 2014, talking about the breaking Ebola news. Alex Jones is still on the line. We're still waiting to connect with Joe Biggs, who is live on the scene in Dallas. We've got Governor Rick Perry coming up with a press conference, and we're basically urging both Perry and our listeners to call the White House and urge them to cease all flights from West Africa into the United States. British Airways, this is an article from back in August 27th, out of the Daily Mail. British Airways halts flights to Ebola-hit Sierra Leone and Liberia for the rest of the year. And it's not only Britain that did that over a month ago. Air France did the same. Emirates, the huge airline company out of the United Arab Emirates, also halted flights into the country from these Ebola-hit countries. Yet now for more than a month, the United States failed to do so. We have the first Ebola patient now, almost confirmation. I think it actually has been confirmed, or at least the likelihood of a second Ebola victim, one of the family members of the individual that's there in the Texas Presbyterian Hospital, at which we've got our reporters live on the scene. But Alex, we're putting out the call both for our listeners and for the media to urge the White House to order this cancellation of flights from West Africa, because we've seen in an article from Defense One this morning, which is up on the Drudge Report, there's really no way to screen for Ebola at airports. Of course, we know it's got a 3-week period where somebody could show no symptoms whatsoever, and the temperature scans that people could go through at the airports are basically completely useless. It's admitted in this article. They didn't work back in 2009 for the swine flu outbreak. They're not going to work with Ebola. So the only solution, it seems, is to stop those flights coming in, Alex.
Well, that's right, Paul. You're absolutely correct. And again, our media is so lapdog, so controlled, so insane, so pathetic, that when we pointed out a month and a half ago we should cease flights, they attacked us in publications everywhere. This is what they do because they want to get it in the country, get the crisis going, use it as a power grab, use it as a destabilization program, and then the feds and the globalists can, again, play the part of the saviors. This is a classic divide and conquer, order out of chaos, Hegelian dialectic program, and there's no debating it. And so we need to get the phone number to the White House out, just so they know we know. We need to get the number out to Rick Perry's office. We've got our reporters there on the ground with their mic up on the stand. They're going to get a question into Perry in Dallas coming up at the start of the next hour. I don't care what break it is. We skip it once Perry starts speaking and going to those questions, because this is so important. And it's not just because this is in Texas. But I was saying, shut down the flights long before it hit my state and my hometown. This is a serious situation, to say the least, because if we don't get this contained, they will use it to take so much control, and it could really start spreading. And, of course, undoubtedly, if he was here for 4 days sick with Ebola, walking around his family and so many others, I bet money that he's already given it to other people. You said that last night in the special report that he undoubtedly will probably spread it. Now they're going to spread it to other people. And now thanks a lot, federal government. Thanks a lot for doing what you do so great. You're not like Kiefer Sutherland in 24. You're a bunch of folks that burn down the business and collect the insurance money. And I'll guarantee you, a lot of people that have gone along with this system are going to have their families affected by this one way or another, economically or physically, by the crisis this is going to create. There's still a chance of maybe to turn this around if they shut down more flights as it spreads exponentially around Africa. I mean, if you've got, hundreds of thousands of people now with it, and they say it's going to be millions, and I guess we're just going to let the millions of people that are able to flee come here. I mean, hell, they say anywhere you are in the world, come here, we'll pay for everything. Why not announce, it's politically correct. If you have Ebola, come here, we'll put you, in a school next to some American kids. I mean, that's how over the top 2 + 2 = 5 is, and you didn't build your business, and Obamacare is free, and all this other bull is, and no other nation would act like this or behave like this. We knew the fix was in when they started shipping Ebola patients into the U.S. We knew the fix was in when they didn't shut down the flights or didn't even try to screen people. We knew the fix was in, and now the hospitals won't even ask somebody who's sick coming in from West Africa, from Nigeria, hey, were you around people with Ebola? This is ridiculous. This is what America is, trained to lay down, trained to have no instincts. And by the way, it's not fear-mongering to warn people. If you see smoke coming out of your neighbor's roof, If you see smoke coming out of your neighbor's roof and you don't see them awake, you go and you bang on the door. Bob, Carol, or whatever their names are, get out here. Your house is on fire. You call the fire department. That's taking action. Well, our government saw 50-foot flames shooting out, and they ordered gasoline thrown on it. And then now they're going to show up once it's burned down and do a press conference on the ashes with a bullhorn talking about how America came together and Homeland Security and Obamacare, helped with the hundreds of thousands of Americans that got Ebola. These are the type of scenarios we're facing because the globalists are launching global destabilization plans, and believe me, they're not going to stop here. If they're crazy enough to think they can get away with bringing in Ebola patients and letting people fly in from Africa where countries are collapsing, while everybody else is controlling this, if they're going to do that here, they're going to do everything else. Katie, bar the door. Katie, bar the door. They are he's going to sign executive orders to take the guns. He's going to sign executive orders to end the borders completely. They're going to sign executive orders to shut down all the power plants. They're going to do, and if you don't like it, an armored vehicle's coming to your house. Well, okay, fine. Those cops are going to have their kids die from Ebola too. So everybody go ahead. It's a suicide pact. Do whatever the New World Order says, run by a bunch of banks that have robbed us blind and hate our guts. Let's just submit to them and do whatever they say and let them set up random checkpoints on the highway and have the government listen to our phones of the Tea Party and harass pro-lifers, but we can't check people coming in from Ebola countries. This is how ridiculous it all is. Paul, I'm turning it over to you and Joe Biggs from Dallas and Josh Owens in Dallas. They're courageous to go up there and be near the hospital. We got Rick Perry's press conference coming up with our questions and more. And if you're listening to this transmission, folks, you're not a bystander. You're in the arena. Get on the phone. Call the White House. Call Congress. Call the media. Call Fox News, CNN, and say, listen here, you little chicken-necked establishment state-run media whores, you prostitutes. We expect you to ask Rick Perry and to ask Obama and to ask the White House press secretary, why haven't you shut the flights down? Why are you bringing Ebola patients here? But no, you don't question. That's being a conspiracy theorist. You sit there and you stick your head in the sand and you do whatever the government says. You people deserve everything you get in the government media and in the system if you don't speak out now, okay? Where are your survival instincts, dumbasses? And I don't mean to use those type of words lightly, but that's what it is. Get up off of your butts, stop being morons, and get involved and realize we aren't alarmist. We're realist here. We know what we're talking about. We immerse ourselves in this. We're committed to freedom. We're committed to America. We're committed to the Republic. We're real, folks, and the reason we see so alien, the reason we see so weird to a bunch of domesticated serfs is because we've turned into jellyfish slaves. And so when people act like real Americans, or people act like real Westerners, or people that have basic survival instincts, we're called a bunch of scum. No, we're not. We tried to stop this, and now it may get out of hand, and I'm sure we'll get the blame for it in the end. Paul Watson, God bless you. It's up to you, listeners. It's up to you to get the whore media up off their butts and to ask real questions, to put heat on these politicians so they can't basically have a joint suicide pact with everybody to bring Ebola into this country. And even if this doesn't get out of hand, and I hope it doesn't, what does it say about these people's mindsets? What does it say about how they operate? That they would try to do this, obviously try to get Ebola going in the country, so Obama can act like a savior. He is Barack Ebola from now on. President Obama is Barack Ebola. God bless you all.
There goes Alex Jones. And remember, it was President Obama who said that Ebola, it would be, quote, unlikely for Ebola to arrive in the United States. And of course, we were called conspiracy theorists and fearmongers for weeks on end. In fact, CBS News wrote an article attacking InfoWars, attacking me directly after I appeared on the Michael Savage show, simply to go through some of the evidence that Ebola could have mutated, it could have gone airborne. And we were attacked, we were demonized. Now the media is basically trying to downplay this. The CDC is trying to downplay it for obvious reasons to prevent hysteria. But I think there's also another reason why they're trying to downplay it, and that's because they've dropped the ball completely. They've been caught with their pants down. The health authorities there in Dallas, this individual came into the hospital with Ebola symptoms. They gave him antibiotics and sent him on his way without asking any questions whatsoever about his travel history. He had come from Liberia, which of course has been ravaged by Ebola. In fact, Anthony Fauci, the head of the National Institute for Allergy and Infectious Diseases, he told CNN this morning, I was watching this in the hotel room, that it was, quote, an enormous red flag that they didn't ask this individual about his travel history, given that he's obviously, he's a black gentleman. He's come from Liberia. He's obviously got a foreign accent. He's got Ebola symptoms. They gave him antibiotics and sent him home. And for a total of 4 days, he was wandering around Dallas and God knows where else, infecting other people, potentially. They're now talking about a second Ebola case. The Health and Human Services official has indicated that a second case is probable. And here we have the article from prisonplanet.com. Texas Ebola patient was sent home for 2 days with antibiotics. So he went to the hospital. They gave him the antibiotics. They sent him home. No questions asked. The Associated Press reports that the man who traveled from Liberia to Dallas on September 20th was dismissed from the Texas Health Presbyterian Hospital on the 26th after seeking care. He was evaluated and given a prescription for antibiotics, with hospital workers believing he had some other ailment. So, again, they completely dropped the ball on it, yet we've been called fearmongers and conspiracy theorists for the best part of 2 months for simply warning about this situation arriving in the US, which it now indeed has. And, of course, Obama said it was unlikely, and even Chris Matthews last night on MSNBC got in an argument with Ezekiel Emanuel about the fact that Obama basically broke yet another promise almost that Ebola would not arrive in the US. Obviously, the precautions were not taken. There's another article, I believe, out of the Washington Times with the CDC admitting now that they were not prepared for this, despite the fact for telling us for 2 months that they were prepared, that this was very unlikely. Let's go to that Chris Matthews clip now from MSNBC, where even Matthews, who of course said he got a thrill up his leg for the Obama speech back a couple of years ago, is now on the offensive against Obama over this Ebola situation. Let's go to that clip.
Yeah, but I'm just getting back to the president's statement, Doctor, and that is that the president said it would be unlikely if we had a case in this country. Unlikely to have even one case.
He said it wouldn't be an Ebola outbreak.
In the second part of his sentence, he said that in the unlikely case, someone brings it here. Well, they've done it. We're living in the world of the unlikely already. That's all I'm saying.
Okay, that's enough of that. And remember, we also had today Sanjay Gupta on CNN. We're trying to find this clip. I saw it on an article earlier. They since changed the article. And we've got that clip now. This is Sanjay Gupta explaining the fact that although this is not airborne, as far as we know, it's quite easy to pass on to other individuals merely by shaking their hand. We think of, exchange of bodily fluids as something more than that, but sweat glands can achieve that, especially if you've got a broken area of your skin in your hand. And here's Dr. Sanjay Gupta on CNN this morning explaining how that works.
So a couple of priorities, Wolf. First and foremost, you have the first person diagnosed with Ebola in the United States. The care for that person, obviously, of paramount importance. But then going back, finding all those contacts, putting them in a situation where they can't possibly spread Ebola and monitor to see if they develop any fevers. So,
okay. That's Dr. Sanjay Gupta on CNN, I believe, either last night or this morning, talking about how easy this could spread. Obviously, we know it's not airborne, but the key fact, I think, is the threat, which is the threat of hysteria. It's not necessarily the threat of a pandemic or an epidemic of Ebola. It's the threat of hysteria, which could grease the skids for this medical martial law situation that many people have been concerned about since, for example, 2001 with the Model States Emergency Health Powers Act. We've got Joe Biggs. I think we'll go to him after the break now because we're coming up on a break in a couple of minutes. But we got Joe Biggs live on the scene in Dallas. We're going to go to him now just before the break. Joe Biggs, you're there in Dallas. What's going on? What's the situation?
Roger, I'm here at Ground Zero in Ebola, USA, where patient zero is. There's a lot of things unfolding right now. We have that confirmed patient with Ebola. Right now, they have another individual that's hospitalized or monitoring that have the symptoms of Ebola, so they're going to keep an eye on that person. One of the things, though, that was crazy, though, I heard you mention it earlier on the show, Thursday, the patient tried to check himself in, and they turned him away with flu-like symptoms and gave him antibiotics. So that's quite a long period of time where he's been able to have contact with many individuals. There was an expert, Ebola expert, on last night at one of the local stations. I stayed up till 2 a.m. watching local news to see what they had to say. And the Ebola expert said that he fears that there will be, quite a few more. One of the last people in Africa that got Ebola was one man. He infected 19 people. So it's a very, very scary thing, and it's a very big possibility that this person has infected many other people.
And Rick Perry's coming up there in about 15 minutes, I think, with a news conference. Alex was on the show earlier. We're calling on Perry to ask the White House to shut down flights from West Africa into the United States. Biggs, if you could ask Perry a question, that would be great. We'll be back with more Ebola news. Joe Biggs live on the scene. I'm Paul Joseph Watson. This is Infowars.com. Stay tuned. We're back on the Alex Jones Show, this live edition Wednesday, October 1st. We've got David Knight in studio for the second and third hours. We've also got Gerald Salente coming up in the third hour to talk the latest financial news, the attack on Syria, the offensive against ISIS, Bitcoin, and more. We'll also be taking your calls at the bottom of the next hour on Ebola mainly. The calling number is 1-800-259-9231. But for the moment, we've got Joe Biggs live on the scene at the Texas Presbyterian Hospital in Dallas, Texas, covering the latest Ebola situation, one confirmed case, likelihood that a second patient has been infected, a family member of the victim. And we put the call out earlier for people to contact the White House to urge them to cease flights into the United States of America from these West African countries. Britain, France have already done that. The United States failed to do so. Now we have the first case arriving from Liberia. We got Rick Perry coming up with a press conference here in about 10 minutes. We're going to try and catch some of that, and hopefully Biggs can get a question in there. Joe Biggs, other points on this case. You said you were up until 2 a.m. watching the breaking news coverage on this, other facets of this Ebola situation.
Yeah, I flip back and forth between, your hardcore mainstream, your Fox News, your CNN, your MSNBCs, in between that and then what the local media is saying. The people in Dallas they've been put on a high alert, to be very, very careful while they're out. If anyone with any symptoms, people are on high edge here, very tense, very scared. The local media, when you could listen to them, you can see it. This is a big problem that they are worried about, and they know that this man was able to roam freely for quite some time after he tried to admit himself. So there's no telling who he came in contact with, who that person there came in contact with, that person, so forth and so on. There's a lot of people that could be affected by this one man. And like you said, that's a great point. Why haven't we shut down those flights coming from West Africa into our country? That's something that needs to be stopped immediately.
Also, this morning we mentioned earlier the clip of Zachariah Thompson, the director of Dallas County Health and Human Services. He mentioned, as far as I can recall, the possibility that they're keeping children home from school in the Dallas area or in the immediate area surrounding that hospital. I'd like to get some confirmation on that if the writers could help me out, because I remember he mentioned that. So, as you said, Joe, it seems that the media and the authorities in the local area of Dallas are quite concerned about this, whereas generally in terms of nationwide media, we get this message about, this is nothing, we've got this isolated, it's nothing to worry about. Obviously, that's what you would expect them to do to prevent hysteria. But as I said earlier, they got caught with their pants down because, as you mentioned, Joe, this guy was walking around for 4 days. He came in 2 days before the case was confirmed. They gave him antibiotics and sent him home. So, Joe, we've been called conspiracy theorists for the best part of 2 months for warning about this. Now it happens, and it seems like it's an attempt on behalf of the CDC and the medical authorities to cover their behinds, because they could and should have asked this guy about his travel history and caught this at least a couple of days earlier.
Yeah, that's standard operating procedure for any kind of hospital, especially when, talks of Ebola have been going on for, a couple months now. That's something when someone shows up, that's, sign A. If someone has flu-like symptoms, hey, where have you been? Have you traveled anywhere? That's a very important question for someone like that in a hospital like this. This is a very big, hospital. Very nice, lots of money put into it. You think that they would have people here trained to deal with something like that. But then they're telling you right now, the CDC's coming out and saying, well, no, all these hospitals in the area are well equipped to deal with Ebola patients. Well, I don't see how that's possible when you guys aren't even well equipped to ask the proper questions to find out whether or not a patient that comes in might possibly have Ebola.
Okay, Joe Biggs live on the scene. David Knight coming up. Stay tuned. We're back on the Alex Jones Show. I'm Paul Joseph Watson, filling in for Alex today. Obviously, we've got huge breaking news on the first case of Ebola confirmed in the United States. We've got our reporter Joe Biggs live on the scene with Josh Owens there in Dallas. We're waiting for Rick Perry to give a press conference, which is coming up in the next 5 to 10 minutes. So we're going to try to get some audio feed from that. We're going to take your calls at the bottom of the hour on 1-800-259-9231. That's 1-800-259-9231. Obviously on Ebola, then we got Gerald Salente coming up in the third hour. We'll ask him about the Ebola situation and much more, including Syria, ISIS, Bitcoin, and the latest financial situation. But now I'm joined in studio by David Knight. David, your comments on this unfolding Ebola situation?
Well, I guess, Paul, the first thing I was thinking was, with you being here from the UK, I started thinking about how they quarantine dogs in the UK. You know, since from 1897 until 2012, they would quarantine any dog that was coming into the country for 6 months, as you probably know. Now, they changed that policy in 2012. What they did was they changed it to 21 days if they were a non-EU country. They would change it to, if it was the EU or the US, it would be 21 days. It would be 3 months if it was outside of the EU or the US. But still, they're quarantining dogs. Why can't we get them to treat us at least with as much respect as they have for dogs? I mean, we can't even get the kind of treatment that you would expect for dogs. As Alex was saying when he was talking to you, why not tell these people, if you're going to come in from a country where there's a pandemic going, we're going to isolate you. You'll have to pay for this isolation. You're going to be set aside for 21 days while we monitor you. They are checking people for fever when they put them on the planes. But, of course, this flight is anywhere from 22 to 33 hours, anywhere from 2 to 3 stopovers to go from Liberia to the United States. So, you know, something can happen within that period of time. And, of course, they're not following those patients. Once they come in and check them for fever and they make it onto the plane, there's no more tracking of those patients, and there's no testing of them once they arrive at any of these stopover destinations, whether it's in Europe or Asia or wherever, you know, when they're coming to the United States, depending on which direction they go.
And that's interesting, David, because I remember back in 2009 during the swine flu outbreak, when we arrived, I was flying into China, into Shanghai from Britain, and they did the testing when we arrived. So we couldn't even get off the flight before we could enter the airport. They came on in full hazmat suits and were giving the temperature test for every individual passenger. It seems the situation now with this Ebola case is very lax. As I said earlier, Air France, British Airways, and Emirates, which are 3 huge airlines, banned all flights from West Africa as of the end of August. America basically stood back and did nothing, despite Obama at one point saying this was a global security threat, even though he said it was unlikely that Ebola would arrive in the United States. They don't seem to have prepared any measures. Now we've got articles out of the Washington Times where the CDC said they were underfunded, they weren't prepared for this. Yet all along they told us not to worry, that they would deal with it if it happened. Yeah,
and clearly, as that story broke the other day, I think you were the one that broke it about the CDC putting the information out there that how to handle dead bodies that had people who had died from Ebola. They put that information out there after they knew about this patient, because this is something that, depending on whose chronology you look at, they first learned about it on either the 24th or on the 26th. The press conference was yesterday, the 30th. So, and in the interim, they put together this thing about dead bodies and sent this out everywhere. I'm not as optimistic as the CDC is. When I look at this, I see staggering incompetence at the very least. I mean, anybody who doesn't think that this was a deliberate propagation of a pandemic has to look at this at the incompetence and just be absolutely amazed.
We'll be back shortly with more from Joe Biggs and David Knight on the unfolding Ebola situation. I'm Paul Joseph Watson. This is the Alex Jones Show. Infowars.com. Keep it locked in. We'll be right back.
Introducing the first proprietary oxygen-based intestinal cleanser, OxyPowder. Backed by real FDA-approved phase 1, 2, and 3 clinical trials. People are suffering from all kinds of digestive issues these days. All the toxins from the air, the food, the water, ultimately ends up in the gut or affects the gut. My main focus was to come up with a remedy for this, something that's safe and effective that anyone can take on a regular basis to keep their intestinal lining clean. My recommendation is to clean your intestines at least 2 to 3 times a week to prevent the toxic buildup from going into your bloodstream. Take your health into your own hands and start cleansing your body today with Oxy Powder. Secure your Oxy Powder today at InfoWarsLife.com. That's InfoWarsLife.com.